Basically, go hit the streets. We knock on motel doors. We work with fan advocates, which is a family access network in the school systems, to try and get a good idea of what the homeless population looks like in Central Oregon. While you may have your 5 or 10 homeless guys that you recognize on the corner by Cascade Village Shopping Center, there was over 2,100 homeless individuals in Central Oregon that were counted last year. And I wouldn't even say that's a completely accurate count, being that we're doing it in the middle of winter, and a lot of folks are kind of socked in during the winter time. So we think our count is skewed based on the time of the year that we do it. And while you would probably say, why don't you just change that? We're actually not allowed to change that. It is the Department of Housing and Urban Development determines what week of the year we have to do the homeless count, and that's the week that we're required to do it. So, like I said, it's happening next week. Antioch has been involved for I think 4 or 5 years, from everything to supplying the van that we've driven around in to deliver supplies to folks, to the power bar drives, to propane. So I know last year Antioch had supplied a bunch of propane. We got some good donations, and I was driving around a pickup truck with like 700 bottles of propane in it, which didn't feel so safe. My wife's like, please drop them somewhere.
Hey, Kenny, what is 2,100 or 2,500, whatever it is, per ton, 80,000? How does that percentage-wise stack up to different areas that we might know?
Percentage-wise, we're much higher than anywhere else. Portland has pretty significant homeless numbers, but as far as population goes, we're near the top of the list in Central Oregon. And I couldn't really tell you why that is. From what I hear from folks is that we're a very friendly community, and we're pretty good at taking care of folks. I'm from Southern California. One of the reasons that I moved here, and one of the reasons that I love this place, is that you get the highs, the people looking at you when you walk down the street, the acknowledgement that you're a person, all that kind of stuff that we value in community is all here. In other areas of the country that I've been, it's not always there. So that's a big thing that folks who are living on the streets really value here. So, and I wouldn't say to stop that so they go away. We'll talk about kind of some options that I have, and I'm kind of coming at this from a little bit of a different take, because I know a lot of you probably struggle with homelessness, and how do you handle such a big issue when you're living your lives on a day-to-day basis. Do you take that guy or that woman and do you let them come into your home and take a shower and feed them dinner? Now, I wouldn't say that that's the best thing to do. From a safety standpoint, but I think there's other things that God requires of us as we go out and see these folks and as we deal with those situations. So there's just a couple photos there of some kids. That kid in the middle was about 14 years old, and his dad had him running meth for him out of his house. And he's still actually living on the street. You might actually see him around occasionally, but he's out there still, and that's one of the reasons why he's homeless. And then that picture at the top is just one of my favorites. That's a dear friend of mine who helped start Icon City and has since moved out of the area. And the gentleman there, you may have seen him downtown as well. He's around. He's got some mental illness, which is a frequent problem that we see amongst homeless populations. So, kind of boring definition of homelessness: folks who are living in places not meant for human habitation. Living in an emergency shelter is considered homeless. So if you're staying at the Bethlehem Inn, you're considered homeless. Basically, a place that's not permanent. If you're not like on the lease, if you're not on mortgage documents, then you're kind of considered homeless in that situation. Doubled up in somebody else's house, you're living in a motel, you're living in your car, all those situations you would be considered homeless. So last year's homeless count, as I mentioned, we had 2,198 homeless individuals that we counted. The 1,260 number is the significant number in my mind, as well as the children, which we'll get to. But the 1,260 is significant because once you're in homelessness for that amount of time, it becomes an everyday reality for you. Just like you getting up to take a shower in the morning, a homeless person gets up and thinks about, how am I going to find a place to stay tonight? And that becomes their existence for an entire day. And then they relive that same thing over again the next day. So I do a lot of work to do upfront prevention on homelessness. So if you have a family that has hit hard times, we try and prevent the homeless episode in itself, because we don't want folks to get to a year, because then it becomes more difficult to obtain a job. It becomes more difficult to obtain housing. You start to see physical deterioration. You start to see drug use. You start to see alcohol abuse. People start losing their teeth, which becomes a big barrier in obtaining a job. That's pretty significant. We have 156 seniors that were experiencing homelessness last year, 483 disabled individuals, 306 who were victims of domestic violence, and 104 veterans. The veteran number has actually gone down due to some resources that have come into the area around housing geared towards chronically homeless veterans. So there's kind of an emphasis on that. A lot of the folks in the 104 category don't qualify for veteran services, and so that's why they're still living in homelessness. If you're a veteran and you've been dishonorably discharged, you actually don't qualify for the VA services, so you end up usually in this homeless category. So how many buses are up there? That's how many school buses you would fill with children to equal the amount of homeless kids under 17 that live in Central Oregon. What caught me as even a greater image of that is nearly the size of 2 of our largest elementary schools in Central Oregon combined together. So it'd be like if you fill both those schools up with all homeless kids. To me, it's not acceptable that we have those issues. A lot of it, you have broken families, you have parents that are abusing drugs, you have single mothers that are raising kids, and I put that verse from James down there because it talks about visiting orphans and widows, and to me, a lot of these folks that we serve out there are orphans and widows. And while they may have a husband or ex-husband that's somewhere, they're usually not at all engaged or involved or even trying to talk to their kids or anything like that. And my responsibility, I think, from a biblical standpoint, we'll go into this a little more, is to defend the cause, which you see a lot in the Bible. You see this defend the cause. I think from a practical standpoint, we always want to say, I want to give somebody food and I want to see somebody smile and I want to do something like that. But I think on bigger levels, we can be advocates in our own kind of social circles for what's going on around homelessness. We can do the defending. Now I'm going to get a little bit political, and I hate politics, and I work for the largest federal funded organization in Central Oregon as far as housing is concerned. But I know that one of the things that bothers me a bunch is that I see a lot of us that defend political points of view all day long. And I would say that I don't hardly ever see people defend the widows and the orphans. I see people defend Republicans, and I see people defend Democrats. You see people defend Obamacare. But I don't see the defense of widows and orphans. The kids that were moving in tonight, I took them into Safeway a few weeks back and was buying them groceries. And I kind of got some flack from people in the grocery store for even walking these kids through there. And to me, it's like, as far as standing with them, like I'm standing with them. And I don't consider myself, and I don't think we should consider ourselves any different than they are. I mean, for me, I could be there. You hear the one paycheck away, one medical condition away. A lot of folks have things that come up in their lives that they have no control over and cause significant financial implications that lead to homelessness. And they're faced with making extremely tough choices, like, do I allow my child to live or do I continue to live in this home? In June of last year, my 9-year-old was diagnosed with type 1 diabetes. And I'm extremely grateful that I have supports around me and that I have a good job and that I had somewhat of an insurance policy. I can tell you that if I didn't have those things, that would have been followed by probably bankruptcy, possibly homelessness, loss of cars, all that kind of stuff that would eventually lead you into where you're living on the streets on a regular basis. And then you're trying to treat a disease that needs to be kind of temperature controlled and all that kind of stuff. You're trying to treat that while living out in the street. That's not easy. And we're actually, now that I didn't even know what type 1 diabetes was, to be honest. And after going through that, we started to focus a lot of attention on medical conditions of chronically homeless individuals and how can we create better medical outcomes for them by housing. So one of the things, the Central Oregon Homeless Leadership Coalition is the largest coalition in Central Oregon of social service providers. So we've got the Bethlehem Inn, we've got fan advocates, we've got Neighbor Impact. We have representatives from pretty much every organization in Central Oregon. Central Oregon being Warm Springs, Jefferson County, Crook County, Deschutes County, so every area there. About 3-4 years ago, we created, it's a mandate from the governor, is that each area has to create a 10-year plan to end homelessness. Now, don't let the term confuse you or anything like that. I do not believe that in 10 years homelessness will be gone. I don't think that's possible. But we did come up with a series of goals, which is always good to have a series of goals as far as what you want to do. We came up with a series of goals, and these goals actually have more in-depth strategies around them, but these are the goals that the Homeless Leadership Coalition is working on a monthly basis and trying to pursue. So homelessness prevention, housing is one of the, if not the biggest thing. You have a house, you're not homeless, obviously. But housing is the biggest thing that you can do for folks to stabilize them. Like I had said, it's hard to maintain temperatures of insulin, and it's hard to monitor medical conditions when you're living on the street. When you're worried about freezing to death, you can't think about, my hypertension. When you're living on the street and you've got to keep insulin at 78 degrees, and it freezes that night, your insulin goes completely bad, you're going to be in the emergency room the next morning. I think that if I was homeless right now, my kid would probably be in the emergency room on average once a week, if not more than that. So heat would also affect that as well. It's in the medical industry, if you have a homeless woman that is pregnant, 90% of the time that homeless woman has a premature childbirth. The cost on the system for that is $120,000 now. So for an intensive care unit visit, it's at least $120,000. So one of the housing things that we're working on is we think that if we house folks with these complex medical conditions, we can prevent huge cost reimbursement from Medicaid, Medicare, all those types of healthcare systems that, especially right now, they're trying to keep Medicaid reimbursement costs down so they can pay for the additional medical care that everybody's getting, or some of us are getting. Increasing the supply of affordable housing is goal number 2 for us. So building more housing units. My agency is the largest affordable housing provider in Central Oregon. We'll have time. Largest affordable housing provider in Central Oregon. We own and operate around 740 units of affordable housing. Probably some of it that you have no idea is affordable housing. So for those of you who know where the post office is downtown, visit Ben Jackalope Grill. That whole building, we built that whole building, that's all affordable housing upstairs. Great spot for affordable housing because a lot of folks who live in affordable housing is your workforce. Those are folks who are working at coffee shops, they're working at resorts, they're doing all those jobs, and they need a place to live that's affordable for them. And often they have to walk places, so being in that downtown area is a very good spot for them. And one of the things that we get pushback on a lot is, you built housing for those people, that's too nice. And that just drives me up the wall. I won't go into that though. So appropriate support services. One of the big things that we're also trying to work on is making sure that we're not duplicating things. That if one agency is doing something else, we're not competing for the same resources. We're not trying to do the same thing. When I came into the business, in the social service work, I always thought it was really strange that people fought for resources. Like, no, this is my homeless person. And it was, for me, that was a very weird thing to even say. We're all trying to accomplish the same goal. If we can wrap services around somebody and provide services on a continuum level, then we're going to be much more effective. System improvement, so improved communication and coordination amongst agencies. That's where the Homeless Leadership Coalition has really been effective, is getting everybody together on a monthly basis. And you guys are all invited to come to those Homeless Leadership Coalition meetings on a monthly basis. We meet at the downtown Bend Library at 8 in the morning on the first Friday of every month. Ken's actually come before. But it's great to have folks from the faith community engage in these issues. Social service agencies are having budget cuts like crazy right now. Federal budgets are being cut, state budgets are being cut, and the real only way for us to accomplish what needs to be accomplished is to have the faith community come alongside and assist. And we've run into a lot of issues with that, and I'm not going to name churches or anything like that, but there's been situations where churches don't want to be involved because the things that we're doing aren't approved by the church. And we're trying to break those barriers down. I know Brooklyn Wagner has been pretty involved in the Bend Faith Network, which is another organization that is basically a group of the faith community that meets together to talk about how they can assist the Homeless Leadership Coalition and help combat poverty. Education and outreach, I guess I'm kind of doing that right now. Better data collection, so our homeless count, we do a really good job at our homeless counts every year, and we're getting better and better every year that we do it. And it's really tough when you're like driving around trying to find a homeless camp on BLM land. It's not that easy. So I saw this the other day, and it had an impact on me. Because I think we confuse equality and justice. And we think justice is making a level playing field. Well, I can tell you that 99% of homeless folks will not be on a level playing field with you or I. This is where the defense comes up. And lifting somebody up to the level where they are at that same place with you, where you're putting them in a place that's going to better their lives. For us, when we started Icon City, going downtown and talking and hanging out was bigger than feeding or giving clothes. It was more important. It was the relationships. It was like, you're acknowledging that I'm a person right now, and that's really different for me, and it's really valued. So that's why I kind of talked about the inviting the homeless person into your house. I don't think that's, and I've actually had to tell my wife that I don't want you to do that. So I don't think that's the safest option. I think it's better to, if you're walking downtown, you see somebody who's homeless, you can always sit down and talk to them. And if homeless people have mental issues in a lot of situations. You're going to get people who don't want you to talk to them. They're going to push back on you, but you can't say that, I don't do this anymore because that one time, bless you, because that one time I did it, that guy was kind of angry with me. I have folks that get upset with me, that get upset with my staff constantly, but we have to have perspective from where people are coming from. I've dealt with mental illness in my own family within the last 10 years. My dad has actually had some bipolar issues, and it taught me a lot about how I think about how somebody else thinks, because we don't know what people have been exposed to. We don't know where they're coming from when we're talking to them. We don't know what just happened 20 minutes ago in their life. We don't know what happened 20 years ago that impacts how they interact with you and how they interact with society. There's a lot of factors that impact that, but I think God calls us to love them no matter how their brain works, no matter if they acknowledge that you just help them or not. We're not out there to help people because we get a reward at the end of doing that. We're not out because there's a thank you. We're not out there because there's a certificate that you get presented with at the end. We're out there to pursue justice, to lift people up into a position where they feel like the community is acknowledging them and they are a part of that. The homeless community wants to be a part of this community, and that's why they're here, because they look at it and they value it and they want to be a part of that. So I have a couple things that you can do here, just simple stuff. Organizations need volunteers all the time. If you have a passion about something, go do some research on it. You can go onto the Homeless Leadership Coalition website, find out what agencies are doing. You're more than welcome to shoot me an email and say, I have a passion for this, where should I go? I'd be more than happy to send you along to organizations that are doing stuff. Advocate. I think there's that big responsibility of finding out what needs are, finding out what's going on a political level. I mean, you can look at the newspaper. You can read up on what's going on a state level and find out how you can be involved. A lot of you probably work in industries where other people around you are probably not thinking about this kind of stuff. I would say that you should talk to them about it. Like, say, hey, are you aware that there's 914 kids in the school system that are homeless right now? Did you know that there's kids in your kid's classroom that are homeless? I think creating awareness is really key. We have to be aware before we can address the problem. Keep it simple. This is one of the things that my family started doing, is just like, some brown bag lunches in the back of your car when you drive around, and if you see somebody on the corner, and give them something to eat. You can start conversations by doing that kind of thing. And I'm going to pitch Icon City because that's one of my things, but a few years back we started what's called the Be Remedy text line. Basically, every Thursday we text out a need in the community. So typical needs are like formerly homeless single mom needs a bed for her kids. You can respond to that text message by saying give, and then we coordinate a pickup and delivery of the item, or we can allow you to go deliver the item to the person that needs it. We have, I think, over 1,400 people on that text line right now. All you have to do is, in the subject line, you put the word icon, I-C-O-N, and then in the where you're putting the phone number, you put 80565. Kind of like voting for somebody on American Idol, but has a little bit more meaning. That's a great way to get involved. I have families that take a look at that text every week, and they talk about it at the dinner table on Thursday night, and they're trying to talk with their kids about it and trying to figure out how they can help meet the need. And sometimes you won't be able to, sometimes you will. We ask for service sometimes. Maybe it's car repair, maybe it's, hey, you got any firewood? We don't ask for money. That's one thing that we've made a policy, is that we're not asking for money. Typically, we're asking for stuff that you probably have in your garage that you don't use anyways. And you know that we all want to get rid of that stuff. So, and then I think prayer is probably the #1 way that we can have an impact on our community, and asking God to show us how we can reach out. I think it's really, really important to be wise about how you reach out. There's a lot of folks who have very good intentions who mess things up a ton because they don't have wisdom in how they do it. And we need to be really smart in how we're handling that stuff. And then there's our websites right there. If you want to find out more about Housing Works, I didn't really talk about that. That's actually my full-time job. So you can find out more about what we do. I mentioned that we own a lot of housing in the area. We administer about $7 million a year in rent assistance to Central Oregon households as well. So we're doing quite a bit, but the resources are pretty slim, especially here. We're an overlooked community as far as Oregon goes. We're 3 hours from everything, and it's really difficult to have a voice on a state level as far as policies and stuff go. So it's really important that we're involved in that. Just wanted to open it up for questions or comments, or like, that was dumb.
Okay, so in my job, what I do, I work in a doctor's office, and we have the doctor, we have the RN, we have behavioral health, and we have me, the community health worker, and so it's like an all-encompassed care setting. So I get the referrals for the homeless people, and I mean, I've been working with people a lot to try and find housing, and it's just not available. I mean, we're signing in for lists, but they're your long waiting lists, and is anything in the works for some type of temporary, immediate, you have 3 months that you can stay here so you get back on your feet and transition into something different type housing in the works, or?
There's some of that going on. I think on a policy level, addressing an issue for 3 months doesn't get it. It needs to be longer than that, which requires a greater amount of resource. Usually if you stabilize somebody for 3 months, by the 3rd month they're like, okay, now I can focus on what I need to do next. And then it's like, okay, now I'm going to take away the assistance from you because your 3 months is over. That becomes really tough. The vacancy rate in Central Oregon in rental units right now is under 1%. So there's not, out of all the units that we own, we have waiting lists for every single one of them. And you were probably referring people to our waiting list.
Believe me, I know. I've filled out all those applications.
Yeah. So we open a housing voucher wait list every year, and we take applications. And in the past, last year we took 1,584 applications, which is a lot. It's 8 years that people have to wait to get housing assistance on average. This year we took 2,200 in 5 days. So there's, like I said, there's not a lot of resource in Central Oregon. We're working on a lot to try and develop more properties that would help folks. And then we're working on a couple pilot projects that would rapidly rehouse families that are in homelessness, but it has to do with medical, which would be right up your alley.
That,
And I can tell you more about that later. I don't have any money for it yet.
Eric, in the context of just ending homelessness, from a strictly like a number count, I know that's really not, you know, it probably won't ever completely go away. But you also mentioned kind of how we're attracted to the homeless community because of the community that is here that supports them, and it seems like that also goes in line with ending homelessness, but it's not in a way that is just strictly providing homes for people without them. That there's more of a holistic community mindset to ending homelessness. Is that something where you feel like you're wearing two different hats and you have to have two different conversations, or do you feel like that's all one conversation, that one kind of feeds into the other on policy level or on awareness level?
I think all of that should be tied together. I think that's where we fail, is we silo these things, and then you create something that doesn't line up on a community level, and then it fails. If we're not creating things that the community values and the community's on board with, there's going to be a big struggle as far as making that happen. I've heard some folks use what's called bus therapy because of the folks that come into Central Oregon, and their idea of ending homelessness is give them a bus ticket. That's, you know, it seems really harsh, and in actuality, in some situations, it is a good idea. Central Oregon doesn't have a ton of jobs. You know, somebody told somebody somewhere that they should move to Bend because there's jobs. And then they got here and they're like, where's the jobs? And you're like, I don't know, you should probably go back. So, I mean, to answer the question, we have to work those two things together. Giving somebody a bus ticket is not, I wouldn't go up to somebody and say you should leave. That's not the best way to create community. So there's conversations you can have around that I think are much better to have, like, you know, have you been looking for a job? There's no jobs here. Well, is there jobs in other areas that you might be able to take advantage of? Those types of things.